Well, welcome everybody. This is Angie Hughes with Producers XL, and you're on my podcast, which means if you're a friend of my podcast pals, you know that we do this on the last Tuesday of every month. Podcast is called The Long Term. And I got to tell you, I'm pretty excited. I think I even said that last month. So I guess you're seeing my excitement every time I come on and do my podcast. But this time, I promised you 2022 was going to bring me some different conversation topics. And I have to tell you, I have got a super special guest for you this month. I am really excited to announce or introduce. I have Lene King. She is with Brookdale Home Health, and she is a home health coordinator here in my hometown. Now, I want you to know that I have taken Lene to coffee twice, and it's selfish on my part, right? It's an easy, small little cup of coffee, but yet the vast amount of knowledge that I get from her in my industry, in the extended care planning space, is beyond invaluable. And I have to tell you, her and I, when we get down and start talking about coffee, we have to actually say to ourselves, okay, well, we're going to have to stop. We've been at this for an hour. We could do this for 4 more hours. So Lene, I want to stop talking for a minute and say thank you for coming on my podcast.
It's all my pleasure, Angie. It is my pleasure. I feel like these are very important topics, and I feel like they are close to home to me. And I feel like they are valuable information for anyone that's listening to your podcast to know about.
Most certainly. Super excited. So I'm going to throw out a term, and I think people are going to think, and please don't disconnect from the podcast when you hear me say the first word, because I don't want you to think that we're going down a path of, this isn't a political conversation. This is not a, do you believe this? Do you believe that? This is the words I want to say to you. And then I want Lene to explain exactly what that is that she's seeing. And the word is COVID deconditioning. Lene, what does that mean to you?
To me, it means it's rapid deterioration, as this has all taken place over these last 2 years, of your muscles, your bones, your mind, due to the lack of physical activity. It's general deconditioning. That's what it's all about. And it takes months for somebody to get back to their norm. So what has happened, this all came across the ocean. We were all told to quarantine at home, stay home so that we didn't get the virus. As time progressed, we started getting the virus. Some people did not, but those that stayed home actually went through deconditioning. And now it's extending even into more deconditioning, has Omicron's coming, and we're getting more types of this virus that's not going to go away. It's here to stay. And we have to learn how to live a new norm. And it's something that's affecting a vast majority of our population. And right now it's hitting the younger kids.
Yeah. And so Lene, that is what I find interesting. And when you and I had coffee, I don't know, a week or two ago, you told me, you said COVID deconditioning is actually a diagnostic code used at the doctor's office.
Yes.
And I can relate to this personally, as I have family members that, now that I think about it, this is exactly what's going on, because you said a lot of what you're seeing at the home health level, right? Because that's what you do. You're a home health coordinator for people that need to be at home and they need health assistance.
Yes.
You're finding that we're having an immense amount of pressure ulcers on legs. You've got edema and swelling and respiratory, right? The lack of circulation. I mean, there's just a whole host of things that go along with this, but you're seeing that at the home healthcare level. And what I thought was interesting is you had made a comment that this really, at this point in time, is really not age dependent, right? This isn't just seniors, but it's also now the younger folks. And right before I hit the record button on this, you and I were talking, and you said, I have somebody right now that I'm trying to get into. I'm trying to find, what did you say? I'm trying to find a place. I'm trying to place him. Yes. And you said, but his payer won't pay for it. Well, this person happens to be under the age of 65, which should tell everybody on my podcast, right, that that's major medical health insurance. And kind of bringing this all back to my industry in the insurance space, right? We tout it all the time that long-term care or extended care insurance is designed for those people that are chronically ill, not acutely ill. So it's kind of a no-brainer for us. All my agent friends that are on this podcast listening say, well, yeah, of course, Angie, your major medical health insurance isn't going to pay for an extended care need. But Lene, people don't know that, do they? Does your client know? Did he have any idea? He just knows, I have a health condition. I need help. I don't need to be in the hospital. I don't need to be in the nursing home. I can get this care at home, but yet my insurance isn't going to pay for it.
Yeah, that is correct. You are right. And what happens is his wife leaves the house during the day and she goes to work to help pay the bills.
Mm-hmm.
And the expenses are just becoming astronomical for them.
Oh, go ahead.
It just breaks my heart because it's going to be months before he gets better. His lungs collapsed while he was in ICU. So he was there for 6 months. He pulled out of it. He survived. He's home, but his respiratory issues are immense. And it will take him probably, I'd say maybe till September before he gets back to being where he was prior to his hospitalization.
Wow. And so take that now and drive that to those folks that are chronically ill. I always hate to use the word, the elder, because in my mind, I don't think people that are on Medicare or 65 and old, I don't think they're old. So it's hard for me to say, well, fast forward that now until you're, older, but take that to somebody that has chronic health conditions. And now they've been basically sitting at home, whether or not because they just couldn't get out, but they've lost a ton of mobility, right?
Right. And a lot of them even have, skin integrity breakdown, which has led to pressure ulcers, which has led to going to wound care clinics, which has led to extra bills that they can't afford to pay, that they are going to have to spend down to Medicaid, because this is something that's not going to go away for them.
And Lene, I'm looking because I was absolutely intrigued by this whole COVID deconditioning and how it's impacting the home healthcare scene. I actually looked up this code, this 2022 ICD-10-CM diagnosed code R53.81. Not that means anything, but I found it to be fascinating because it talks about it's applicable to chronic debility, general physical deterioration, malaise, and nervous debility. And then, you come down into some other things. And it was fascinating to me that, the clinical information says a disorder characterized by a feeling of general discomfort or uneasiness and out of sorts feeling. I mean, we're talking, this is a real diagnostic code that Medicare or CMS is physicians are using this to bill for, because we're finding out that folks are in need of home health care just for these reasons, not even just a medical perspective, but one of them even talks about, a mental disorder characterized by chronic fatigue and physiological symptoms. So, or just and I'm air quoting, an out of sorts feeling. It's fascinating to me that care is being rendered because of that. But if you stop, and if anybody's known anyone that's basically, I don't want to say homebound, but anybody that realizes that some folks haven't really had their mobility, they're experiencing a lot of that stuff. And so now physicians, and especially you, Lene, and your team and your home health agency, and you guys are really out there trying to get these people their mobility back, get their strength back, get them doing more active things, because it's not good, right, for the human body. A body in motion stays in motion, right?
Right. I had a doctor in town tell me, Lene, just always remember, motion is lotion.
Oh, I love that.
And I will never forget that. He's probably my favorite ortho doctor in all of Saline County. And he just, motion is lotion. And we've got to get up. We've got to get moving. Get rid of the rollator. Go back to your standard walker. Go back to your cane. just walking to and from the bedroom to the fireplace. We've got to be moving. Set the timer, get up and do it. It's going to make you feel so much better.
Yeah, I like that. I like that you said get up and get back into the pain, because you're right. I mean, you think about that. You have a surgery. You often think about, well, why in the world they just brought me back from recovery and they're already getting me out of the bed.
Mhm.
Motion is lotion. The body's got to move.
You've got to move to stay ahead of your pain. All of your narcotic pain medications are okay, but they also have side effects.
Mm-hmm.
Therapy doesn't have side effects. So just get up and stay. Motion is lotion. So every time I turn around right now, it's a new COVID case. It's a new challenge where somebody's struggling. They went to the hospital. They thought they had pneumonia. They found out that they had COVID and tested positive. They go home. They can't get the oxygen. They have the respiratory failure. And it just breaks my heart.
Mm-hmm.
There is a 69-year-old, which is young, Medicare patient who has sat so long that he actually started getting a heating pad on his back.
Oh, yeah.
Now he has burn marks on his back.
Yep. You know what? I have had that very same thing happen to a loved one of mine where, I mean, we ended up seriously fell asleep with this heating pad that didn't have, believe it or not, it was one of the older ones, didn't have a 2-hour shut off.
Yes.
2nd degree burns.
Yeah.
I mean, it's unbelievable. But tell me from the home health, tell me from the service end of things, not maybe necessarily just your agency, but what are you seeing when it comes to home health care? Like, right, can you guys go see somebody and take yourself into that Medicare patient, that person that maybe is on Medicare, so 65 plus, they're chronically ill. You guys going in there every single day?
No, Medicare does not allow home health to go in daily. They say that if a patient needs daily help, they must go skilled. So, and what's happened is, of course, nobody wants to go skilled right now because you're in a congregate setting.
Yeah, little fear there.
Congregate setting, and one person gets COVID, the chances of spreading is great. So a lot of people, don't want to go, or if they are not vaccinated and they go, they have to quarantine for 14 days, which is total deconditioning. So it's people are wanting to stay home, which is wonderful. And we want them to age in place at home, but Medicare does not allow home health agencies to go out daily. So you start to stagger your visits. Okay. Maybe we're going to start with just nursing twice a week. And then on the other 3 days of the week, we're going to bring in therapy, which is physical therapy. Then we're going to switch to occupational therapy. You start keeping your disciplines starting later so that you can keep patients on longer. But they've got to be doing they've got to be their biggest advocate. They've got to be doing their own exercises. They have to be doing their own therapy. And when people like my mom and dad were growing up, we were workaholics. You were out taking care of the farm. You were out making money, putting food on the table. You weren't out doing exercises. You weren't out doing therapy. You weren't going to the gym.
Yeah.
So it's a struggle to ask people to change how they do things.
Oh, sure. Well, and then compound that with just maybe general malaise, right? You just don't feel good. So compound that. I mean, it makes you even less motivated. Tell me a little bit, and you're going to end up educating all of us on this podcast, but tell me a little bit about this, and I hope I say it right, the 2020 CMS PDGM model. What is that?
So in 2020, Medicare came out with what they call the PDGM model, which is patient-driven group model. So what that means is we can no longer bring someone on services based on symptoms. There has to be a true diagnosis. So say a doctor came to me and said, okay, Lene, I had this patient that needs some help. And I said, well, what's going on with your patient? And he said, well, he's got weakness and deconditioning. Okay, that's great. He's got the weakness, but why does he have a weakness? Is it osteoporosis? Is it spinal stenosis? Is it neuropathy? What? I have to have a diagnosis in that doctor's visit note. And it could be the new one with COVID deconditioning. It could be that diagnostic code. So
Mhm.
we go out and we start them on services. Medicare says you must go in, take care of the patient and get out. You have like maybe 7 or 8 therapy visits per episode is what we call it.
Mhm.
From start to finish of home health, it's called an episode.
Okay.
So we're only allowed a few amount of PT, OT, ST visits.
Wow.
Because what is happening in the world of Medicare is we're in the biggest baby boomer population there is right now that's aging. Okay. So Medicare is being restrictive of their dollars. They've
Sure.
got to be our people like myself that as we want to age in place, we're not going to have the Medicare dollars if they don't start kind of saving them.
Mm-hmm.
So we have to go in, we have to teach and train, we have to do some therapy, we have to leave them with their own exercises to do, and we must discharge.
And
You
you're there
can't-
how long?
So at the max, 6 weeks, at the very max. By the time you start off with nursing, and then a week later introduce physical therapy, and maybe a week later introduce OT, you've got to start discharging.
And how
Each
long is
visit.
each one of those visits roughly? So you go in for, are we talking you guys are there for 2 hours?
No, well, sorry, but
No. I'm just
Um,
teeing these up for you.
yeah, a start of care, which is how we bring someone on. A start of care lasts between an hour and a half to 2 hours.
Okay.
We're really getting to know that patient in their home environment.
Mhm.
What all can we do under the Medicare guidelines to keep this patient aging in place at home?
Mhm.
Because Medicare wants us to keep people at home because of course, less
Yeah,
Medicare dollars. that way.
less expensive.
So we're going in, we're getting them started with that hour and a half to 2 hour start of care.
Mhm.
That start of care is done. Medicare calls it the Oasis. And then we send the plan of care to the primary care physician.
Mhm.
And that primary care physician must sign that plan of care, either add, take out, do whatever he wants to do with his patient because he is our boss for that
Mhm.
patient.
Mhm.
And then within 48 hours, we will introduce the next discipline. So from the time we get the order, we have 48 hours to get started under the Medicare guidelines
Mhm.
with whatever discipline it is, nursing, PT, ST.
Mhm.
And then we're going to introduce the therapy after that. And then once again, the plan of care is sent to the doctor for the therapy side of things.
Mhm. And so when you go in and do physical therapy, 45 minutes to an hour?
45 minutes to 50 minutes. And 5 minutes of every visit must be education. And it must be an education on the diagnosis.
Mhm.
Whether we're educating on neuropathy, whether we're, a good example is lymphedema. There's a lot of education done on that. So we must go in and do 5 minutes of education on every single visit with the patient.
And so really that's your hour, right? So 50 minutes, 45 to 50 minutes is the therapy, 5 minutes is the education. So
And
think
we're
about that. 6
Yeah.
weeks, best case scenario, and you're doing, different therapies inside of each one of those, whether it's physical, occupational, whatever the case is, general nursing, whatever that is, 6 weeks
Mhm.
maximum that you're in there. No wonder it's critical for that patient to do things on their own because you're not there a long time. And so now this whole COVID deconditioning is a big deal. So you take somebody that's been sedentary for 2 years for the most part, and you guys are basically in 6 weeks trying to regain what they lost in 2 years.
Yeah, we may only have 11 or 12 visits of physical therapy, occupational therapy. So, we are not in there very long.
Mhm.
So it's almost key. One of the first questions I ask whenever I get a new referral from a PCP is there somebody in the home with your patient?
Mhm.
Is there somebody there? Is there somebody that's going to help them? Because if not, I'm already trying to figure out new
Yeah.
ways to help.
Pretty tough.
It is very tough. It is very tough. Bless the couple that, one has these issues and the other one has these issues, but they can work together. Like, my
Mhm.
parents, one's vision is bad, but the other one, her vision is great. The other one, the hearing is bad, but the other one, the hearing is great. So they work together.
Yeah. If we could all guarantee that could happen to us, right?
It would be a blessing. Yeah,
Yeah,
it would
wouldn't
be
it?
great.
Absolutely. Lene, any other, I usually try to keep these, I mean, you and I think could keep going. And can you imagine what would happen if I opened, opened all of this up to Q&A?
Yeah.
You would, you'd lose a day of your life just, talking to all of us. But what is inside of all of your home health care in the extended care planning, right? So I say everybody wants to be at home. Everybody, I mean, you hear everybody clamoring, oh, just get me out of this hospital. I just want to go home. Now you amplify that with a very sedentary lifestyle. We're now getting additional health concerns. I mean, I just can't help but think that having a private pay policy would be a wonderful way for somebody to make sure that maybe if Medicare was paying part of the bill, but they wanted additional care, they wanted, and they had a policy, Medicare wasn't going to pay for this, but my private policy would pay for this, where maybe they thought they could get a little bit more treatment and maybe they could actually get better. I mean, it's kind of endless for me. So I think this is so critical, and I can't thank you enough for coming on and doing this with me, having this conversation. I'm sure it's opened up a lot of questions in a lot of people's minds. But when you actually kind of, and disregard the pun about me actually being in Kansas, but you pull that curtain back and you can see the Oz back there making all the noise. It's kind of interesting, the inner workings of what's actually going on at the care level and what people probably really should be planning for as we age and as we progress, because not only, birthdays are a wonderful thing to celebrate, but that means you're also 1 year older. And I don't think many of us escape life without, I guess going through some deconditioning, if you will, using your term, in our lifetime.
I'm telling you, Angie, if I could turn back time, the one thing I would do is get everybody a private pay policy, especially right now. And here's why. Think about it. Our biggest shortage is in healthcare. I mean, you could go to a hospital right now to see a loved one and they're not in ER and they're not getting admitted. And that hospital, that ER doctor will say, well, we don't have any beds. It's not the beds. We don't have the staff.
Yeah, it's the staff.
That, and if I could turn back time, that is the one thing I would do, is preach and preach and preach and preach and preach to the highest mountain. Get a private pay policy. I probably have 8 phone calls a day that just tug at my heart, because these people don't have anyone to help them in their home. They need help with meal prep. They need help with transferring on and off the commode. They, their urinary incontinence is so bad that they're doing laundry twice a day and they don't have any help to do the laundry. I mean, my mom and dad have been very blessed and done very well in their life, but they never got a private pay policy. And so children are moving into the homes, the adult children, to help their mom and dads, or they're moving them into their homes. Get a private pay policy, because I'm telling you, I'm not exaggerating. I get probably 6 to 8 calls a day. How can I get help with my household chores?
Wow.
For free.
Well, I can't think of a better way to wrap up this month's podcast, but I also want to say, FYI, I did not pay Lene to say that. That truly came from her own heart.
It came on my heartstrings, because I probably had to return 2 phone calls today already.
Yeah. Lene, thank you so very much. I wouldn't be surprised if I don't reach out to you and buy you another cup of coffee at some point during the year, just to pick your brain on what life looks like as we get a little farther into this year and see what things look like. So thank you, thank you, thank you. I hope everybody enjoyed this podcast. Please join me next month, the last Tuesday of every month. I'll go live and you can hear who my surprise guest is for next month. Lene, thank you again.
Thank you, Angie.